Hello guys, I'm sure that you're all okay, you're all enjoying life, you're all enjoying studying ultrasound, you're all enjoying practicing ultrasound, and also you're enjoying my videos. Today I'm going to discuss about the liver infections and how they could appear on the ultrasound images. In the last videos I mentioned that liver hosts multiple pathological processes ranging from congenital abnormalities to acquired benign and malignant tumors, and I will cover all these topics in separate videos. Today I will discuss about the liver infections and its presentation on the ultrasound imaging. So let's start. Viral hepatitis is a common condition and caused by five distinct viruses ranging from hepatitis A, B, C, D, and E. Further, clinically, it subdivides into acute hepatitis and chronic hepatitis. Acute hepatitis is mainly caused by hepatitis A and E virus, while chronic hepatitis is caused by hepatitis B and C. As far as the clinical presentations are concerned, they both present with a different clinical presentations. But when we examine all these patients on the ultrasound shows some particular patterns for the acute hepatitis and for the chronic hepatitis. In this video, let's start from the acute hepatitis first, how it will appear on the ultrasound images. First important sign of the acute viral hepatitis on the ultrasound images are enlarged liver. So the liver would be enlarged more than 15.5 centimeter and it will appear hypoequic. On this slide you can see that the liver is enlarged and liver appears hypoequic. So this hypoequic liver is a characteristic of acute viral hepatitis, and you have to measure the size as well. The size would be more than 15.5 centimeter. Another sign of the acute hepatitis is a starry sky sign. On these images you can see multiple bright echogenic foci within the liver. Actually these are portal veins, and portal vein walls gets brightened and sometimes it gets thickened as well, so it is called as a starry sky sign, or is also called as a periportal cuffing. On this image you can also appreciate brightness of the portal vein wall, and which is also called as a periportal cuffing. So this is another classical sign of the acute hepatitis on the ultrasound images. This is another image. On this image you can appreciate the same characteristic, hypoequic liver with echogenic portal veins. However, hepatic vein does not affect because it does not contain any wall. Only portal veins are affected and it appears echogenic on the images in acute hepatitis. Another finding beside the hepatomegaly, there would be thickening of gallbladder wall due to secondary to edema. Here in this slide you can appreciate thickened gallbladder wall. This is a classical example of the acute hepatitis. In acute hepatitis there will be hepatomegaly, there will be edematous gallbladder wall, and there will be a periportal cuffing or echogenic periportal wall or starry sky sign. So these are the three characteristic signs on the ultrasound for the acute hepatitis. While writing the ultrasound report, your report should have all these information that the liver is enlarged in size and it appears hypoequic with echogenic portal veins showing starry sky sign. Gallbladder wall is also thickened. In the conclusion, mention that features are suggestive of acute hepatitis. Beside this, also mention that clinical and laboratory correlation is suggested. So this would be your classical ultrasound report. Chronic hepatitis is caused by hepatitis B and C, and sometimes it leads to end-stage disease. On the ultrasound, the first change would be in the liver parenchyma. Liver parenchyma appear coarse. Here in this slide, you can appreciate coarse parenchyma. In this slide, you can also see coarse parenchyma. Beside the coarseness, there will be irregular margins. So the margin of the liver would become irregular. In this another slide you can see coarseness of the liver parenchyma. Beside the margins are irregular, it's not smooth anymore. In this slide you can see free fluid around the liver. Here this is the end stage disease where the liver is markedly reduced along with the ascites around. Spleen would become enlarged and you can appreciate the fluid around the spleen as well. In this slide, you can see thickening of the wall with edema. So this is wall thickening with edema. Ultrasound finding for chronic hepatitis would include coarse parenchyma of liver with irregular wall, splenomegaly, thickened gallbladder wall with edema, and ascites as well. Development of ascites depend upon the stage of the liver disease. If it is end stage disease, so there would be a marked ascites. While writing the chronic liver disease, you must mention that liver is normal if it is normal, or liver is small in size and shows coarse parenchyma with irregular margins. No focal lesion seen. Write down gallbladder shows thickened wall or gallbladder wall is thickening. Spleen is enlarged, measuring whatever the measurement is, give the measurement. Mild to moderate ascites noted. In the conclusion, there are 2 points, 2 types. Either write down cirrhotic liver with ascites and splenomegaly, or write down features are suggestive of chronic liver disease. Mention that clinico-lab correlation is suggested. After discussing viral infection of the liver, I am going to discuss about the bacterial infection of the liver. Bacterial infection is also called as a pyogenic infection because it causes abscess on the liver. Sometimes there will be multiple abscesses, sometimes there will be single abscesses. Sometimes it may present as a small abscess, or sometimes it may present as a large abscess. So how you will appreciate these abscesses on the ultrasounds? Let's start watching all these images, and through the images we will come to know that there are multiple presentations of the liver abscesses, and beside this we will also discuss how we will write the report for the liver abscess. Liver abscesses are very common and very easy to appreciate on the ultrasonography. It shows multiple presentation. First of all, there will be an irregular wall and the lesion would be a hypoechoic. In another presentation, you will appreciate low level internal echoes, and sometimes there might be gas producing organism which appear as an echogenic foci within the lumen. So these would be a gas producing organism, and you will appreciate low level internal echoes within the lumen of the lesion. On the ultrasound and on the CT scan, it will appear like this. On these images you can see both multiple hypoechoic lesions with irregular wall with low level internal echoes, and these lesions involving both right lobe and left lobe. Usually liver abscess are multiple, but it may appear as focal lesion as well. For the bacterial infection report writing, a mention on the report that liver parenchyma shows either multiple or single, well-defined, hypoechoic lesions. Measuring, give its measurement in 3 dimensions with irregular wall, internal echoes and calcific foci in the right or left lobe. In the conclusion, mention right or left lobe liver abscess with a volume of 10 ml or whatever the volume is. Always give the volume at the end so that it would be helpful for the surgeon or medical colleague for the further management. Fungal infection of the liver is also very common. This is called as candidiasis, and this mycotic infection of the liver appears as an abscesses. We have discussed about the bacterial infections, bacterial abscesses, how it will appear on the ultrasound images. So far this mycotic or candidiasis or fungal infection is concerned, it has its own particular presentations on the ultrasound images. So start watching all these images and we will be able to differentiate between the bacterial abscesses and the fungal abscesses. And beside this, I have also mentioned how to write the report for the fungal abscess. Candidiasis or fungal infection on the liver appear as an hypoechoic mass. On this image you can appreciate a well-defined mass, a hypoechoic mass with surrounding hyperechoic halo, and this is radiologically called as bull-eye sign. So a well-defined hypoechoic mass with surrounding echogenic rim, that is the characteristic of candidiasis or fungal infection. Sometimes this fungal infection appears in another form as well, like it appears as a well-defined hyperechoic mass, slightly hyperechoic than the surrounding parenchyma, with a focal necrosis. Small cystic area can be seen either in the central part or in the peripheral part. On this image you can appreciate it on the peripheral part. So this is another classical presentation of the candidiasis on the ultrasound. So these two presentation is for the fungal infection, is for the candidiasis. On the CT scan it will again appear as a hypodense mass with hyperdense surrounding layer, and it will appear like this. So this is the classical example of candidiasis on the liver. For writing the fungal infection, your report should have these information. Liver shows well-defined complex cystic lesion, give the measurement with surrounding hypoechoic halo. Or if there is another presentation, so mention that heterogenic mass, give the measurement with central necrosis in the right or left lobe. In the conclusion, write down that features are suggestive of liver abscess, most likely fungal. Parasitic infection of the liver is also very common, and that is caused by Entamoeba histolytica. So that's why it is called as amoebiasis. It presents on the liver as an abscess. How it will appear, how it will look like, and how we will appreciate. Beside this, how we will differentiate it from bacterial abscess, fungal abscess, and amoebiasis. Although on the ultrasound images these looks quite similar, but still there are subtle changes. So keep watching all these images and try to figure out the minor differences, so you will be able to differentiate the amoebiasis from the other abscesses. Hepatic infestation is caused by multiple parasites. Entamoeba histolytica is one of them. It appears on the ultrasound as a round or oval lesion. You can see a round and oval lesion on these images, and it also appears as a low level internal echocyst. There will be absence of the wall. You can't properly appreciate the internal thickening of the wall, so there will be no wall thickening, but within the cyst you can see the low level internal echos. So here on this image you can appreciate an oval shape, small cyst and multiple cysts rather, and there are low level internal echos, and this is the classical example of the amoebiasis. So but you have to compare the diagnosis with the clinical features, ultrasound findings, and other serological imaging. For writing the parasitic infection of the liver on the report, mention that liver shows a well-defined round or oval mass, cystic mass, give its measurement with low-level internal echos in the right or left lobe. In the conclusion, mention that features are suggestive of liver abscess. Always give differential. Differential include amoebiasis or candidiasis. Keep in mind that on the ultrasound images, bacterial and fungal and parasitic infections look similar with subtle differences, but therefore it is important to correlate clinically and serologically. So therefore always mention this on your report, that clinical lab correlation is suggested for the confirmation of the diagnosis. Hydatid disease of the liver is very common, and it is caused by Echinococcus granulosis. On the ultrasound imaging, it is divided into 4 grades: grade 1, grade 2, grade 3, and grade 4. These 4 grading on the ultrasound images are very peculiar, very interesting, and very easy to distinguish. So how we will appreciate all these 4 gradings? Let's start watching these images, and on these images, on the basis of these images, you will be able to differentiate all these 4 gradings. Hydatid cyst is caused by Echinococcus granulosis, and it shows multiple sonographic features, especially on liver imaging. It appears as a simple round cyst with low level internal echos, and you can appreciate on this slide this round cyst and there is low level internal echos. This is the classical example of the liver cyst. On these images you can see a well defined cyst with small detached endocystic layers, and this is another example of the hydatid cyst. It's called as water lily sign. In the third form, which is very common, and this is called as a cyst with multiple daughter cysts. So This is the classical feature of the hydatid disease on the liver, in the liver as well. So you can write down multiple daughter cysts are seen. In the fourth presentation, sometime this mass gets enlarged, becomes heterogeneous, and the wall of the cyst becomes calcified. So on the imaging you can see the calcified mass within the liver. So that is also the presentation of the hydatid cyst, normally called as a grade 4 hydatid cyst. On the CT scan you can appreciate it's a well defined tiny calcific foci, both involving both right lobe and left lobe. Its presentations are multiple, so that's why CT scan is advised to confirm the hydatid cyst on the liver. As hydatid cyst has multiple presentation, so the report should contain all these information. A well-defined complex cyst or complex lesion with low level internal echoes, it would be the first presentation, or it may appear as a well-defined complex cystic lesion with internal floating membranes, or in the third form it may appear as a well-defined complex cystic mass with multiple daughter cysts, or it may be an heterogeneous mass with calcification of its wall. So conclusion, in the conclusion you mentioned that features are suggestive of hydatid cyst grade 1 or 2 or 3 or 4. So when the cyst appears simple with the low level echoes, so this would be grade 1 hydatid cyst. If you could see any floating membranes within it, so that would be grade 2. In grade 3, if there are multiple daughter cysts within the lumen, that is hydatid cyst grade 3. And if it appears as a heterogeneous mass with calcified wall, so then it would be hydatid cyst grade 4. Schistosomiasis is also a very common infection, and hepatic schistosomiasis is caused by Schistosoma mansoni and Schistosoma japonicum. How it will appear on the ultrasound images and how we will be able to differentiate from the other diseases. Actually, there is a particular pattern for the schistosomiasis on the ultrasound images. So let's start watching Schistosoma mansoni or Schistosoma japonicum. Schistosomiasis is one of the most common parasitic infection in human. Liver ultrasound shows widened echogenic portal tracts. On this slide you can appreciate widened portal tracts that may reach up to 2 cm. While usually these all features involves porta hepatis. You can appreciate periportal fibrosis, echogenic lines and echogenic appearance around the portal tracts. Initially the liver size enlarge and it appears hypoechoic, but as the disease progresses into portal hypertension, the liver becomes contracted and it shows portal hypertension's characteristics. Writing schistosomiasis report, mentioned on the report, liver is contracted and its parenchyma shows multiple widened portal tracts, more pronounced at porta hepatis due to periportal fibrosis. So all these information is already discussed, that liver becomes contracted at the later stage and periportal fibrosis occurs. In the conclusion mentioned that features are suggestive of parasitic infection, likely schistosomiasis. Pneumocystis carinii infection is opportunistic infection, usually seen in immunocompromised patients and in AIDS patients. On the ultrasound images on the liver, you will find very particular pattern, and it's really very easy to diagnose pneumocystis carinii on the ultrasound imaging. Pneumocystis carinii is the opportunistic infection usually seen in the AIDS patients. On ultrasound images, as this liver shows multiple tiny diffuse non-shading echogenic foci, usually extensive and replacing all the liver parenchyma. This is another slide. Here you can see the liver parenchyma is replaced by multiple diffuse tiny non-shadowing echogenic foci. So this is the classical example of pneumocystis carinii, and this patient is suffering from AIDS. Report should be written as liver parenchyma shows tiny diffuse echogenic foci replacing entire liver parenchyma, and in the conclusion mention that features are suggestive of an opportunistic infection, most likely pneumocystic carinii, and advise correlation with the clinical information and other radiological imaging is suggested. Yes, friend, this was all about the liver infections. I have discussed at length about the viral infections. I have discussed about all types of abscesses, including bacterial infections, bacterial abscesses, viral abscesses, fungal abscesses, and some other patterns as well. I'm sure through the ultrasound imaging, it will be easy for you to distinguish between all these infections. I have also discussed how to write the classical report for all these pathological processes. So keep watching my videos. My next video would be regarding metabolic disorders of the liver, and also I will discuss in separate video regarding benign and malignant masses of the liver. So please do not forget subscribing my videos and sharing with other peoples as well. So see you in the next videos. Till then, bye bye.